This is breaking news from CNN. Did you know that women in Kazakhstan have the highest death rate from leukemia in the entire world? Today we will discuss this health issue, exploring the problem, potential solutions, and its implications. Leukemia is cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. Leukemia usually involves the white blood cells. Blood cells are potent infection fighters. They normally grow and divide in an orderly way as your body needs them. But in the people with leukemia, the bone marrow produces an excessive amount of abnormal white blood cells, which don't function properly. Leukemia causes are complex and typically involve a combination of genetic, environmental, and lifestyle factors. Key contributors include genetic mutations. Changes or mutations in the DNA of blood cells can disrupt normal cell regulation. Leukemia symptoms and consequences. Leukemia symptoms and consequences vary depending on the type of leukemia. Common leukemia signs and symptoms include fever or chills, persistent fatigue, weakness, frequent or severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tiny red spots in your skin, petahia, excessive sweating especially at night, bone pain or tenderness. In 2017, there were 518,000 new leukemia cases worldwide, with variations in incidence based on type and demographics. Acute myeloid leukemia and chronic lymphocytic leukemia have been increasing in prevalence. The global prevalence in 2017 reached 2.43 million cases, with a slightly increasing trend in high-middle-income countries. Acute lymphoblastic leukemia accounted for 33% of cancer cases in children under 14 worldwide. Women from Kazakhstan are the most likely to die from leukemia in the world. This is data from 183 countries of the world.
Hematopoietic stem cell transplantation, or HCCT, is a powerful and life-saving treatment for leukemia. It involves using healthy stem cells from a donor to replace the damaged or cancerous bone marrow in a patient. Hematopoietic stem cells are multipotent cells that can develop into all types of blood cells, such as myeloid lineage and lymphoid lineage cells. Hematopoietic stem cells can be found in organs like peripheral blood, bone marrow, and umbilical cord blood. When the patient is ready for a stem cell transplant and has a matching donor, the process can begin. Usually, the patient stays in the hospital for 3 to 5 weeks. The first step is called the conditioning regimen, which involves chemotherapy and radiation. This treatment prepares the body by destroying the patient's bone marrow, weakening the immune system to help the new stem cells settle in, and treating any remaining disease. The intensity of this regimen can vary depending on the patient's age and health, either myeloablative or non-myeloablative. After conditioning, the stem cells are infused into the patient's bloodstream through a central catheter, similar to a blood transfusion. Doctors monitor the patient's blood daily to check for engraftment, which means the new stem cells are starting to grow and make healthy blood cells. It is confirmed when the neutrophil count stays above 0.5 to 10 to the ninth power for 3 days, which is basically 500 millions. Engraftment usually happens 10 to 21 days after the transplant. If the patient recovers well and has no major complications, they are discharged from the hospital and continue with follow-up care as an outpatient.
The fatigue experienced by patients after hematopoietic stem cell transplantation can significantly impact their quality of life. Research indicates that approximately 80–96% of patients receiving chemotherapy report some degree of cancer-related fatigue, with a study by Abdurrahman etc. in 2022 showing that 40.5% of patients experienced severe fatigue scores within the first 100 days post-HCCT. This fatigue is primarily due to a significant drop in red blood cell counts, leading to anemia and associated symptoms such as weaknesses and shortness of breath, which can hinder social interactions and daily activities. Moreover, patients undergoing HCCT often face psychological challenges, including anxiety and depression, which can lead to social isolation. A study found that low levels of social support correlate with increased depressive symptoms among patients, exacerbating feelings of loneliness and hindering recovery. According to Rodrigue etc. 2013, this isolation can further diminish the quality of life and negatively affect the patient's emotional health. On a positive note, strong social support systems can significantly improve outcomes for HCCT patients. Research indicates that patients with high levels of perceived social support experience better physical and emotional well-being, lower distress levels, and improved survival rates post-transplantation. For example, a study shows that patients with robust social networks had a 55% survival rate at 24 months post-transplant compared to only 20% for those with low support levels. Colon, etc. 2022. This emphasizes the importance of emotional connection in aiding recovery.